Cross-section of the spinal cord showing the nerves and the roots. So here is our the spinal cord here. You can tell this is the posterior side because we got the posterior side of the vertebra here. So this is the posterior median sulcus and the anterior median fissure here. This is the gray matter surrounded by the white matter. We've got the gray commissure across the center with the central canal at the center there. Remember that connects to the ventricles in the brain. And then around the spinal cord we have the pia mater, the subarachnoid space that's filled with cerebrospinal fluid. That's again connected to the subarachnoid space around the brain. Then we have the arachnoid matter, the dura mater, and the epidural space here and here, which is filled with fat and blood vessels. That's where the epidural shot is given. Then we have the periosteum and then the bone. And then when we look at the structures coming into and out of the spinal cord, these are the anterior roots here. These are the posterior or dorsal roots here. Dorsal is afferent. Ventral or anterior is efferent. So this is the sensory information coming in here, motor information leaving here. These are the rootlets that fuse together to become roots. And then here on the posterior root, we have the posterior root ganglion. That's where we have the cell bodies for the sensory neurons. And then as the structures, as these two roots leave through the intervertebral foramen, they fuse together and become the spinal nerve, and then immediately split into Raimi, a posterior ramus here and here that innervates the deep muscles of the back and the skin of the back, and then an anterior ramus that innervates the rest of the skin and muscles, and then the Raimi communicantes that has a ganglion at the bottom of this that is part of the sympathetic trunk structure. Okay, so we got spinal cord here, epidural space, subarachnoid space, rootlets, root, posterior root ganglion, spinal nerve, anterior ramus, Raimi communicantes, posterior ramus. And there we go.